Okay, this morning we're here with Linda Pruitt, and Linda, you've been a patient for a while, and earlier this year you had an accident. You fell out of your bed,
Yes,
and you started having numbness and pain going down your leg, and also some loss of muscle strength in your leg. So kind of tell us what happened since then.
Okay, well, I got to the point I could not walk up and down stairs. That bothered me a whole lot. When you can't walk up and down stairs and you're used to that. Now, believe it or not, I'm 60 years old, even though I don't look like that. So it bothered me a whole lot.
Yep.
But when I called here and said, I'm getting ready to have surgery, because I'd gone to a neurosurgeon, because that's the first thing they want to do when they see stenosis on your x-rays, which I didn't realize that's the first thing. And they said, okay, what we're going to do is we're going to fuse these two things together with these screws and plates, and we're going to use a cadaver bone to do it. That's a dead person, by the way. And I'm like, okay, if that's the only way to go. Well, I called here and talked to Jessica, and she said, well, okay, if you're not going to be here for a while, fine. And she said, do you mind telling me why? And I said, because I'm going to have surgery. And she said, what kind? And I said, well, spinal surgery. She said, oh, well, we're going to miss you. Wasn't even 2 minutes. Dr. Wickheiser's on the phone. I said, Linda, you don't want to do that because you might have problems after that. Let me take a look at you and let's see what we can do. I'm like, fine. He said, you don't really want to have surgery. I said, no, I don't want to have surgery. You are so right. So I came over here and actually showed him the x-ray and actually showed him the MRI.
Yes, showed me the MRI.
Yeah, I was kind of surprised because he had the MRI up on his computer screen when I came to see him, and I'm like, you look at MRIs too. So after we did that, he said, let's do some decompression because you have a little stenosis, you have a little bit of bulging, but I'm not that concerned about that. I think we can fix this. I think it's your SI joints that are really bothering you and giving you all this pain, but now your weakness is probably coming from, you know, a little bit of stenosis there and the swelling pushing on your nerves. And I thought, I'm willing to try anything. He said, you come every day before they're scheduling that surgery. And I thought,
And so what happened was, basically after about 2 weeks, we decided not to go through with the surgery.
oh yeah, I called him and I said, I need you to delay my surgery. And the lady said, what? And I said, I just need to delay my surgery because I'm getting better. And she said, well, why don't we just cancel it for now? And I thought, oh, do people do this all the time? And I'm like, that was a good thing.
Yep. So that is a great thing. So basically, let me just recap this a little bit, Linda. You fell out of your bed. You started having weakness, pain going down your leg, and the neurosurgeon said that there was spinal stenosis, and they were wanting to go and do a lumbar fusion of your spine. And basically, with the decompression and oxygen that we started you on, we were able to keep that from happening.
I can walk up the stairs now.
And now you can walk up the stairs. You have your muscle strength is back in your legs. And just tell the people, how's your pain level now?
I don't have any pain there.
Okay, so you don't have any pain in your low back, and everything is doing great, and you didn't have to go through a spinal fusion.
Nope.
So basically, if there's anybody out there that they may be, they may just about be to go under the knife, to have some kind of lumbar surgery.
I was within 3 weeks of doing it.
And within 3 weeks of doing it, what would be your suggestion to them to do first?
Is to find out if that's really what's wrong with you and if you can get it fixed any other way without having surgery, because there's no guarantee.
Yeah.
And I know a lot of people some people it helped, some people it made worse.
Yeah. So, basically the most minimum invasive procedure that you can do is always the best.
Yes.
First. So, would you recommend them to come to our clinic and get checked out before they were facing any kind of surgical procedure?
Yeah, I didn't even know you could do this until you suggested it, and I'm like, yeah, let's try.
Yeah.
And it worked.
Okay. Well, thank you, Linda. Thank you for your testimony.
Thank you.